Plus, testing for the gene, Angelina Jolie's eye-opening revelation about preventing breast cancer, and the answers we're getting about when concerned women should get tested.
You're watching 8 News Now at 4:30 with Paul Johnsich and Denise Valdez. The news of Southern Nevada is now.
In a revealing editorial in the New York Times, actress Angelina Jolie announced that she underwent a procedure that some might consider extreme.
Through genetic testing, she discovered that she has a gene that increases her risk of developing breast cancer. So she underwent a double mastectomy in a preventative measure. Jolie finished 3 months of medical procedures at the end of April. According to Jolie, now that she's had the mastectomies, her cancer risk is just 5%. It's a story that's generating a lot of buzz on social media. It's also prompting conversations at dinner tables and between family members confronting the same fears.
Now, women are already calling the doctors asking to have the test that Angelina Jolie had, but is that really something that every woman should be doing?
Paula Francis spoke to a doctor who has specialized in treating breast cancer for many years.
The answer to that question, by the way, is no, not every woman should go through this. Dr. Heather Allen already received several calls from women who had read the article or heard about the Jolie announcement, wanting to know where and how soon they could get the same genetic test. Dr. Allen told me the genetic test is not for everyone, even if you have the average $3,000 it will take to get it. You can find out if you need the test by answering some questions from your doctor. And every woman should do that to have an idea of what your risk for breast cancer is. But the overwhelming majority will not have a risk high enough to even consider genetic testing.
So the easiest thing for women to do is to talk to their doctor. Let them know what their family history is, what their own personal history is, if they've ever had breast biopsies or mammograms that weren't totally okay. And then you can actually calculate with computer programs these days what your risk is.
And every woman should do this.
Every woman should do that, exactly.
If you want to get started before you even talk to your doctor, there are online resources where you can take a Q&A or simply write down what you know on your own. That will also help you prepare for your visit with your doctor. Family history, especially family history in more than one generation, will elevate your risk.
Now, the genetic testing is a different issue altogether.
It's a subset,
and there are very clear criteria as to who might be at risk for having the genetic predisposition, and that's a whole different elevation of risk when you have one of those mutations.
If you have a very high risk of breast cancer, as determined by your doctor and the computer program, your insurance might cover the cost of the genetic test. And by the way, the company which makes the genetic test has a monopoly on it, which means they can charge almost anything they want. The U.S. Supreme Court is actually considering whether the company has a right to patent a human genetic test. I also asked Dr. Allen what she thought of the Angelina Jolie article. The answer to that and some more of our interview is online at 8newsnow.com.
Very interesting, Paul.
Yeah, it started people talking.
It sure did.
Thank you.